My name is Dr. William Long. We're going to be talking, discussing, and demonstrating the use of the Avelle closed incisional wound vac system today. I'd like to start by presenting some of my thoughts on this. We've been using this recently in our practice, in particular for our complex primary total hip and total knee replacements. I think there's some distinct advantages. It incorporates the hydrofiber technology that I've been using for 10 years with the Aquacell dressings. We've become very familiar with that. The literature is very, very strong. The international consensus recently once again supported the use of these silver impregnated impervious dressings for all of our joint replacements. So this is really what I see as an extension of that line to the more complicated cases. I think there's some specific advantages of this Avelle dressing over some of the other closed incisional wound vacs that I've used in past. I think they're all very effective as wound vacs in a closed fashion, but the particular aspects to this that are favorable are its unique portability, its distinct usability, its easy application, and what I've found most of all is that when we see patients back in the office, they have not experienced the difficulties and don't express the complaints to me that they've experienced previously with other wound vac systems. For instance, beeping, failure of the batteries, detachment of the system, air leaks. They haven't had the cumbersome nature of the larger tubing and canister systems that make it very difficult to get dressed and undressed. The Avelle system allows showering, so you can clean, it can be left in place. The very flexible nature of the wound edge dressings reduce the shear stress on the skin, so they're less likely to blister. They have less discomfort. And I think, although I can't prove it, the soft tissue environment is better suited to this. So as the wound is healing and there's a bit of swelling inherent in the procedure, there's less stress on the wound edges, and so we see a very nicely healed incision at the time of follow-up at 3 weeks. So those have really been the advantages I've seen, and to be honest, we've been using it in our most complex cases thus far. So the ones that I would expect to see the most difficulty with wound healing, we have not yet seen a single wound healing complication. Again, a short series. We haven't been using this for years and years. These are inherently complicated procedures, but we've been really pleased with the experience thus far.